Um, to, my name is Julia Grabs. I'm the editor-in-chief for JACC Case Reports, and I'm honored to discuss today with Dr. Alin Gregossian. She's a resident in emergency medicine in Drexel University in Philadelphia, in the United States. Alin, thank you for joining us. Could you tell us more of what happened to you? You have published a very interesting manuscript on second issue of JACC Case Reports about your story.
Sure. Thank you for having me. So basically, I am an emergency medicine resident in Philadelphia currently, and just at this point, it was about 6 months ago, right after I'd actually matched into a critical care fellowship in New York City. This was maybe less than a month after that. I found myself, I had a cough, I was a little bit short of breath. Otherwise, I felt okay. These symptoms started getting worse around December of 2018, and I found myself, I went to my own emergency department instead of an ER resident. I actually went there as an ER patient, and I asked my own attending for a chest x-ray. And I was a great ER patient. I didn't let them do anything else to me. I barely let them get blood work on me. Unfortunately, after we got the chest x-ray, things weren't looking too good. I got admitted for, shortness of breath. We thought maybe there was a pneumonia, but we weren't really sure what was going on because I had some pleural effusions, possibly some pulmonary edema. Things just weren't looking right, and my heart rate was really high at the time. Once I got admitted onto the floors, I actually ended up kind of braiding down. I crashed. Basically, I went into cardiogenic shock, and I required an urgent heart transplant. So my life went from, I went from being completely healthy and with no medical problems, and within 48 hours, I was told that I needed a heart transplant. I got the heart transplant less than 2 weeks after that. I was transferred to the University of Pennsylvania for that. And once I got the heart transplant, I was discharged after about 2 weeks, and then now here I am. I went home, and I'm kind of back to my old self, trying to show people that you can go back to your normal life after something like that happens.
Perfect. You have a very inspirational also blog on Twitter, on social media in general, Change of Heart. What has this life experience provide you as learning points or for us to understand more?
So I think there's a lot you can gain from my experience. I try to put a few things out there for people. There's a lot of important things that can come out of my story, both for physicians and for non-physicians. I think the main thing that comes out of it, or one of the main things that comes out of it, is the importance of organ donation. Being an ER doctor, I'm used to being on the other side of organ donation, how important it is. When we are resuscitating patients, if we're not able to resuscitate them, we always have to call gift of life or, do the proper things to see if we can get people to donate their organs. But, now I could see how important it is being on the other side and being in need of an organ, right? But the other things that I got out of it is how important it is to, be able to empathize with your patients. I see how crazy it was being a critically ill patient myself. Ironically, going into critical care medicine, right? Like, I'm so used to being the one resuscitating the patients that I was never used to the one being resuscitated as a patient. And I never knew what it was like to be able to have the things done to me that I was always doing to my own patients. The other things we can learn from my case is, the importance of just all the things that we learn in medical school. Like, there are zebras that, we don't think we're ever going to see. A 30-year-old female who never had medical problems, you can see them going to cardiogenic shock. I ended up having familial dilated cardiomyopathy, which I assume, as cardiologists, you probably see more often than, we do as ER doctors. But again, it's stuff that you have to always keep on your differential. So there's a lot that could be learned from my story. Another thing that people always tell me, they're like, you were so resilient through it. And yeah, you have to learn that things like this could happen to you in your life, and you can't let these things kind of, let you not go back to your normal life. This happened to me, and I had to deal with it, and I can't let it make me not be the person that I ever wanted to be, right? So that was one of the things that I really took away from it.
Thank you so much, Alin, and it's a great pleasure to have you. Thank you.
Thank you so much.